This is my student support system. Keep watching, keep learning.
And route of drugs. Drugs are available in many forms for administration by specific route, such as oral route, parenteral route. The nurse should be aware of the various drug forms and how they are administered. Certain drug preparations require special consideration regarding administration. Drugs prepared for administration by one route should not be substituted by the other drug forms. For example, when a client has difficulty in swallowing a large tablet or capsule, the nurse should not administer an oral solution, syrup or elixir of the same drug without first consulting the prescribing practitioner or physician, because a liquid may be more easily or completely absorbed, producing a higher blood level than the tablet. First, we will discuss about oral routes, the drugs which are given by oral routes. Most drugs are administered by oral route because it is the safest and most convenient and least expensive method. The disadvantage of the oral route is that it is slower acting than the other routes. Oral route drug forms includes tablets. These are compressed molded substances to be swallowed whole, sometimes chewed before swallowing, or placed in the buccal pocket or under the tongue. So these are the tablets. Then capsules. Capsules are in which the substances are encased either in a hard or soft soluble container or gelatin shells that dissolve in the stomach. Caplets, gelatin coated tablets that dissolve in the stomach. Powder or granules, these are finely ground substances. Troches, lozenges and pastils. Similar preparations of drugs which are designed to dissolve in the mouth. Enteric coated tablets. The coated tablets that dissolve in the intestine only. Time release capsules. Encased substances that are further enclosed in smaller casings that deliver a drug dose over an extended period of time. And sustained release. The compound substances designed to release a drug slowly to maintain a steady blood medication level for a longer time. Syrups. It is made to change the taste of the medicine. It is a thick, sweet liquid often made by adding boiling sugar and water or sometimes fruit juices. Elixirs. These are sweetened hydroalcoholic, means water and alcohol combination liquids for the oral use with medicines. Typically, alcohol and water are used as solvents when the drugs are not soluble only in water. Now we come to the drug forms which are prepared for parenteral route. Parenteral means the introduction of medication by any route other than oral gastrointestinal route. However, medical use of this term refers to injecting the medication into the body tissue. It includes intradermal, subcutaneous, intramuscular, intravenous, intrathecal or intraspinal, intracardiac, intrapleural, intraarterial and intra-articular injections. Preparations include ampoules, single dose vials or multi-dose vials. Then topical route preparations. Topical means just applying over the skin or mucous membrane. The most topical drugs are given to deliver a drug at or immediately beneath the point of application, means where we apply, just it will work just under the skin. Other topical drugs Although the large number of topical drugs are applied to the skin, but some are applied on other tissues and mucous membrane, such as eyes, nose, throat, ear, rectal and vaginal preparations. Topical drugs includes liniments. Liniment means the substances mixed with alcohol, oil or soapy emollients that are applied to the skin. Ointments. These are semi-solid substances for topical use. Paste. These are semi-solid substances but thicker than the ointment and are absorbed slowly through the skin. Then transdermal patches. These are special patches which contain medicine and absorbed through the skin over the extended period of time. Suppositories. Suppositories are gelatin substances designed to dissolve when they are inserted into the rectum, urethra or vagina. Inhalations. Drugs or dilutions of drugs administered by the nasal or oral respiratory route for the local or systemic effect. These are known as inhalations. And drops. Optic means in the eye, optic in the ear and nasal solutions that are instilled as drops.
My student support system. Keep watching, keep learning.